Welcome to Your Health. I'm your host, Rhonda Alford, and joining me today is Celeste Thibodaux, the new Wound Center Director at the Terrebonne General Wound and Hyperbaric Clinic. She's here to share more about what they do at the clinic and a recent award that they won. Welcome to the show, Celeste.
Hi, nice to meet you. How you doing?
Good. How are you?
Doing good.
Well, I'm glad you could take a few minutes out to come chat with us about what you're doing over there. So many amazing things.
It's fabulous stuff that we're doing.
All right. Well, let's get started. You tell us a little bit more about yourself and your role at Terrebonne General.
I have been a nurse for over 15 years in this community. I've been at the Wound Center for over a year now, and I've recently been promoted to now the director of the clinic.
Okay, so lots of experience.
Yes.
All right, well, let's start off talking a little bit more about wounds and what you do. So tell us, what is the Wound and Hyperbaric Clinic?
The Wound and Hyperbaric Clinic is a clinic where we treat several different types of non-healing wounds. We use the latest of technologies and different things to help those wounds to heal.
Okay, so what do you classify as a non-healing wound?
A non-healing wound is any wound that fails any traditional therapy. We go ahead and we evaluate the wounds, see what can be delaying the healing process, and come up with a treatment plan to help that wound to heal.
Okay, and what could happen if a wound is left untreated?
If a wound is left untreated, it could cause to infection, loss of a limb, or even go as far as causing death.
So we don't want that to happen.
No,
for
we
sure. When you know it can be prevented, right? You have all these. So what are the types of wounds that you treat?
We treat a variety of different wounds. We treat diabetic wounds, arterial wounds, venous wounds, traumatic wounds that could be burns or bites. Basically, we treat any wound out there that does not heal. We can go ahead and get that treated and come up with a plan.
Well, what's the kind of, if a wound isn't healing, what is kind of the timeline you would give it before you would seek treatment?
We ask that people come in pretty much as soon as you're noticing that this wound is not healing. It could be a matter of days, it could be a matter of weeks. Just as soon as you notice you have any concerns with it, we advise for people to come in and let us take a look at it.
Right, so really pay attention.
Yes.
All right, well, tell us about the recent award the Wound Center won.
We recently won an award for patient satisfaction.
Okay. Can you tell us a little bit more about what you all do to ensure your patients are satisfied?
We do a variety of different things to make sure our patients are satisfied. We go ahead, we assess them and see what kind of needs that they have to help them get their treatments. We'll help them get supplies. We can help with transportation to help get them to the clinic. We can do a variety of things to help them get treated and get healed.
So any barriers to care, you are there to help them?
Yes, we are.
As far as even transportation?
Yes.
Well, that's good to know. So what does this mean for the community, having a resource like this here?
It means a lot to the community to be able to provide them with the care that they need to help them to heal and improve themselves, improve their lives, and live a better life.
Okay. Is there anything else that you'd like to share with us about the Wound Center?
We also have hyperbarics that we offer to help with the healing process. And also we can help with a variety of different things like the late effects of radiation, from like dry mouth to wounds. We can treat a lot of things with the hyperbarics.
Okay, just tell me a little bit more about what hyperbarics is for people who don't know.
Hyperbarics is a chamber that you can go into that you get 100% oxygen. So that helps to give it to the level of the cells to go to where the injury is noted to help with the healing process.
Okay, so it's pretty high tech, right?
Yes.
And you try to make it not scary, right?
Right. We have TVs that patients can watch. We have a lot of them that just like to go to sleep. And we always have someone in there to monitor the patients.
Okay. All right. Well, how can someone get more information about the Wound and Hyperbaric Clinic?
They can go online and go to the Terrebonne General website. They can also go ahead and call our clinic, and we'll be happy to provide any information to them.
All right. Well, thank you so much for sharing this with us today.
Thank you for having me.
Okay. For more information about the Terrebonne General Wound and Hyperbaric Clinic, call 873-4176 or visit tghealthsystem.com. Thank you for joining us on To Your Health. I'm your host, Rhonda Alford, and I'll see you right back here next week.